My name's Daniel Fryer. I'm a CBT therapist and hypnotherapist here at the Priory Hospital in Bristol and in private practice. And I kind of have a vested interest in medically unexplained symptoms, health anxieties and psychogenic conditions. I was brought on to treat people presenting with a condition called cardiac syndrome X or CSX. And this is chest pain in the absence of any coronary abnormalities. And there's always kind of a hardcore group of people that didn't respond to any of the pain control medication and had all the GPs and the cardiologists stumped. So when I came in, I treated the condition psychogenically. A psychogenic condition is a condition where the symptom is real, but it's either caused by or prolonged by or influenced by your psychology. So that's your cognitive, your behavioural and your emotional factors. Psychogenic neatly sidesteps the label of psychosomatic because that carries a bit of a stigma and people think that you're telling them it's all in their head. Now, a psychogenic condition is different from a health anxiety. That's an anxiety disorder that sits on the OCD spectrum. We often call it hypochondria. Here people are convinced that they're ill or about to become seriously ill. They think that harmless symptoms are the symptoms of something far more serious. They'll fixate on certain conditions, they'll self-diagnose via Google, and they'll make repeated visits to people like you for reassurance. Between the two, the psychogenic and the health anxiety, that's quite a large proportion of your unexplained symptoms already explained. And this is quite important because they do actually account for a fifth of all your consultations. So it helps you to start thinking psychologically rather than medically. Now, with a health anxiety, you never invalidate the symptom. You don't tell them that you're going to prove them wrong. With a psychogenic condition, you actually validate the symptom itself, but you also tell them that you're just going to work along all the psychological factors that surround it. Any chronic condition can actually be thought of as psychogenic. For instance, people with musculoskeletal disorders and chronic pain conditions are 2 to 3 times more likely to develop a mental health issue than those who don't. And having a mental health issue can make you depressed, anxious, angry, all of the above. This will increase your perception of the pain, so you'll think it's more debilitating than it actually is. This will lead to unhealthy coping mechanisms such as not exercising or self-isolation. If I was a GP and I couldn't explain a symptom, or I thought my patient was making the symptom they did have worse than it was through anxiety or depression, I would send them to therapy. Priory hospitals and wellbeing centres contain therapists that can treat using a vast range of modalities, and we offer individual therapy programs as well as group therapy, or both. For instance, CBT is considered to be the gold standard treatment of anxiety disorders, and that will cover both health anxiety and certain aspects of a psychogenic condition. A health anxiety means there is no symptom other than anxiety, in which case you need to send them for psychotherapy. If the condition is psychogenic, then the symptom is real, but it's being caused by or prolonged by or influenced by their psychology, and you need to send them to psychotherapy. Either way, your first port of call needs to be psychotherapy rather than repeated visits to yourself.